You're on.
Okay, music. Da, 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 da. All right, so we're here talking about your weight loss surgery.
Yes.
And you were kind enough to come to clinic at your roughly 3-month mark.
3-month mark, yes, and I'm one happy camper. I'm down 66 pounds, 3 months. Everything is going well. I'm off so many meds I've lost count how many meds I'm off, and everything is normal. And I couldn't be happier because I was on so many meds, and my doctors encouraged me to go forward with this, and thankfully Dr. Rutledge here agreed to do the surgery on me. And
we tried to kick you out there, right?
Tried to kick me out, but I was persistent.
You were, that's right.
And you know, and everything has been just textbook. I mean, it couldn't be better.
Well, we really feared your anticoagulation, and I think you and I talked about that. Anticoagulation, that Coumadin, is just so dangerous, and I think you really get credit for that kind of meticulous management. You were cautious and careful, you did a lot of planning, and the way you managed it post-operatively has just been perfect. And like you say, you're kind of a textbook case, and we see a lot of our Coumadin patients, they go home, their doctor is really not clear on the effect of MGB on the vitamin K level, and all of a sudden, 2 or 3 weeks, sometimes 4 weeks after surgery, there's a massive bleeding complication. And so we really feared that in your case, and it's exciting everything went so smoothly.
Well, you know, the doctor who takes care of that and monitors me really worked well. Before the operation, I wanted to make sure, you know, that he would work with you and with me, and they've been great about it. I was going, you know, quite often right after surgery, and now I go once a week, and you know, things have been pretty stable. I haven't had any flare-ups, thank God.
And they were pretty good about the frequency that we kind of drove you there.
Most certainly. You know, I mean, at first, you know, it wasn't a problem at all, and then I wanted to go. I think I was going 3 times a week. I was going every day, and then 3 times a week, and then we went to every week, and that's where I'm at now. I go once a week to have it checked. And
that's more than usual. Right?
Yes.
Usually, those people are watching, they're going, well, that's crazy.
Usually my son's also on warfarin and Coumadin, and usually we go once a month.
Right. So we've really pushed those boundaries because of our past bad experiences with people on Coumadin. We have found that when the diet is changed so radically with the MGB, it drops your vitamin K, and that stimulates the power of the Coumadin, and all of a sudden we have somebody who has, you know, a vitamin K INR level of, you know, 1.5 and 1.2, and suddenly it's 10.
Yeah.
And that's where we get problems. And, you know, again, I think you should be congratulated. You did a
thank
really
you.
good job.
Thank you. I tried. And I told you I would.
Yeah, you did. And I hope we did a reasonably good job of kind of putting the fear of God in you and how serious that was.
And I think one of the things that helped me along the way was the ability to talk to you every day, you know, to keep tabs on things. So that's a very big factor.
Yeah, and it's critical because we've just seen such serious problems from that. Yeah. Now, just for people listening, it's okay to mention you were diabetic?
Diabetic, big time, since '91, so that's quite a long time. On insulin, diabetic. I was diabetic longer than that, but I've been on insulin since '91. Over 300 units, 6 shots a day, yes. And what prompted me to research this was because of that. I researched on the internet, came across Dr. Rutledge's site, and also found, amongst other sites, that weight loss surgery can improve or eliminate, actually, the type 2 diabetes, and that just says, this is for me. Because my other doctors, my primary care physician, my cardiologist, they knew I was on this downward slope, and they said something serious is going to happen within a couple of years if I don't do something. And I just went along with this. I'm glad Dr. Rutledge went along with it, and I'm feeling great. You can imagine carrying right now 66 pounds more around. I don't have that anymore.
It's like 5 12-pound turkeys or something.
Yeah, you know, I go to the store and I buy the salt pellets, you know, and they're 25-pound bags, and I'm thinking, I can barely carry 2 of those, and here I was carrying more than that.
Every day, every moment of the day, right? Well, I think we should, for truth in advertising, you're not cured of your diabetes yet, though,
No,
right?
I'm not. I was, like I say, I was a pretty heavily user on insulin, and they were going to put me on an insulin pump because I was becoming, or had become insulin resistant, and they were going to put me on an insulin pump, and I didn't want to go that route. They were going to try that. They didn't know it would help. But now I'm down to where I usually take 15 units once a day for sure right now. And sometimes I take 15 units twice a day in the evening, depending on what I eat during the day. If I'm really good, I don't have to take it before nighttime. But I truly expect, since I'm down from over 300 units a day, I truly expect that to continually improve, even more so as I lose even more weight, you know. But I'm hoping that within a month or two I'll be off insulin entirely.
That's what we're hoping too. I think our cure rate is pretty high, so we're still hoping, and it's a little bit disappointing you're not totally cured by 3 months. On the other hand, like you say, that high dose of insulin you showed up with means that we have a little bit more work to do in kind of resolving those underlying mechanisms that made you diabetic in the first place.
Right, right. So.
All right, good. Let's see, what else? A lot of people want to know what you can eat.
Well, this is the part that surprised me, because when I came to about 8 clinics. I live locally here in Las Vegas, and so I was able to come to about 8 or 9 clinics before surgery. And I listened to other patients, and I got a little concerned about what's the diet going to be like afterwards, because I hear some people, they can't eat this or that, and so I thought, well, it's worth it though. I got to do what I got to do, and I'm 3 months out, and quite frankly, I'm very fortunate because I have not eaten anything that I've eaten anything I want to, small amounts because you fill up very fast. But I've been able to tolerate every type of food. I've had, you name it, I've had it so far. And it's just that you fill up fast, and your plate is small. And my wife and I go out to eat, and we get one meal, and she's happy because she gets to have 3/4 of the meal, and I eat a little quarter of it. But yeah, fortunately, I mean, when I say anything, I mean, I've had pizza, steak, I've had scallops, I've had fried rice, eggs, toast. People were saying that bread doesn't go down good. I don't eat a lot of bread, but I do eat bread. Small amount, a half of an English muffin, well toasted, no problem. So, everything like that has been, like I say, I'm just bubbling here. I'm so fortunate.
Yeah. Now, we had a patient in clinic today. I don't know if you saw or heard her. She had a lap band and was talking about how that a lot of foods that you just mentioned, bread, broccoli, hamburger, meat, things like that, wouldn't go down. She'd be throwing up. Throwing up problems with eating any of those things? Or?
No, I have had no throwing up problems. I had one incident about 4 weeks after surgery where I got indigestion, and I had like a dry heave. And I believe, I know what it was because I haven't done it since, and I've never had a problem. And it didn't last long. It lasted about an hour and a half. But I had, before I had anything, I got up in the morning and I said, I think I'm going to have some green tea. And I made green tea on an empty stomach, and it just didn't settle. I didn't put anything else in my stomach other than some pills. And so I took some vitamins and stuff like that, and it just didn't agree. And
a lot of vitamins too have iron, and that's a real common actor for causing an upset stomach. So it might have been that.
So now when I take my meds in the morning, I usually have yogurt before I have the medications.
Right.
So I do that, get something on my stomach first. But no diarrhea, no throwing up, nothing.
Good. Well, that's good. Let's see, what other tips or pointers can we give our listeners today? Let's see.
Well, my biggest tip would be that don't fear the operation. I had open heart surgery 15 years ago.
Oh yeah, how's this compare?
Well, there's no comparison. The worst pain I had was my wife taking off the bandages 2 days after surgery. I was up and walking 3 hours after surgery. The anesthetic, unbelievable. The doctor uses an anesthetic that I didn't even know I was on anesthetic. I remember waking up from my heart surgery, and boy, I was all groggy. I could hear voices and going back to sleep. And I just woke up. I didn't even know the operation was over or that they did it yet. And like I say, no stomach pain. It's just fantastic. Fantastic. No comparison to heart surgery.
Good.
I was in the operation was 34 minutes, and I was in the hospital one night, and I was gone and home. And like I say, it's fantastic. It's unbelievable. I wish I would have had it done 8 or 10 years ago. I wish I would have known about it.
Good, good. Well, thank you very much. That's pretty good. I think that's great. So good. How's
It's
your
all the
wife?
truth, too, doctor. It's all the truth.
That's the most.